Hi, good morning. I'm Katie Agarwal. So I wanted to talk to you about some things around cognition and heart failure. I've got some key points, and I know we don't have much time, but first that it's hard to follow a heart failure regimen. These guys give you a lot of medications to take, and it's difficult. Second is that cognitive impairment, so having trouble with your memory and the way that you can process decisions is very common in heart failure, especially when you're first leaving the hospital after you've been very sick. And we make it a little harder because we think that everybody can just jump to it and carry out this medical regimen that we give them. And it's okay to stop and say, hey, we got to go through this again. Let's repeat this again. Accept a little help. I tell people all the time that I'm not sure why our society thinks that you're supposed to be fully independent till you're age 104. But it's okay to get a little help, and a little help will help you stay independent longer. And I truly believe that. And then lastly, to help your brain, help protect your brain. You want to avoid bad medications. Anything that makes you sleepy is probably not good for your brain. And then second, talk to your doctor if you're worried about your thinking. And then exercise. Exercise, as whatever you can do in regards to exercise, is the most beneficial thing for your brain. I just wanted to show you these pictures. It's not easy to fill a pill box. We act like it's so easy, but it's not so easy. This one on the left is the perfectly filled with only 5 medicines. Probably not too many of you only take 5 medicines. And then the second pill box only has like 7 mistakes, but there's still 7 mistakes in that pill box. And 65% of people in this small study made at least some mistakes in filling out their pill box. So take time and be careful filling out that pill box. And then patients with cognitive impairment, difficulty with their thinking and processing, have even more difficulty and will have even more abnormal ways to fill out their pill box and have more problems if they don't have a pill box in terms of taking their medicines and leaving some out. And so just be really careful and get people to help you fill out your pill box. And the issue around memory and cognition and heart failure is that it's not always just memory, but if it is memory, use cues, alarms to take your medicine, little notes to remember to do this or that. That really can help you significantly. And then sometimes it makes you process a little more slowly, and complex decisions are harder. And so taking the time and getting assistance is really important. Involving your caregivers in every aspect of life is really important to how things come out for you. Not only, but starting with the medication and the heart failure management, the diet, the medicines, the plans, we keep changing the plan. You really need the assistance of your support team. And then I'm just going to throw one more thing in there about financial management. Dear Lord, we're trying to do our taxes this weekend, and it's not easy. And, picking a health insurance plan, all these things are very complex decisions. And maybe in the past you didn't need help, but maybe getting a little bit of somebody to help you with these things could be very helpful. And then avoiding the medications that cause sleepiness, sedating antihistamines like the ones that they sell, some of the ones they sell at the drugstore like Benadryl, are not good for your brain. They can, we want to keep your brain alert. Any over-the-counter sleep aid is not good for your brain. So trying to avoid those as much as you can and talking to your doctor about finding the safest medications that you can. Avoiding too much alcohol because that's really not good for our brains either. Maybe that one glass of red wine, I guess. But exercise is really the only intervention that's been shown to help prevent dementia. So do your exercise and then talk to your doctor about difficulties with your thinking. That's all that I have. Thank you.